Good morning, good afternoon, and also good evening if you're joining us from a different time zone from the US. Welcome to our webinar this morning. We are holding it as part of the Asthma Awareness Month, and the title is Clean Stoves, Healthy Families, How Indoor Air Affects Childhood Asthma. My name is Esther Obonyo. I'm an associate professor of engineering design and architectural engineering at Penn State. I also direct the Global Building Network, a partnership with the United Nations Economic Commission from Europe. I'm going to hand over to my co-moderator, Tonyehn. Please, Tonyehn, take the podium.
Good morning. Welcome everyone to the webinar. My name is Tonyehn Verkitus. I'm the Executive Director of Physicians for Social Responsibility, Pennsylvania. We'd like to thank our speakers today, who are Dr. Steph Lee. She is a pediatrician and preventative medicine public health specialist. She is a pediatrician with Penn State Health in Reading, and her advocacy work focuses on improving health with climate action and public policy through PSRPA, the Pennsylvania Medical Society, and the Pennsylvania chapter of the American Academy of Pediatrics, for which she is the co-chair of the Climate and Environmental Health Committee. Matt Casale is the Director of Environment Campaigns for U.S. PIRG Education Fund, a public interest organization that speaks out for a healthier, safer world in which we're freer to pursue our own individual well-being and the common good. Matt leads the PIRG's work to shift our nation away from fossil fuels, primarily focusing on decarbonizing buildings and transportation. Our last speaker is Chef Chris Galarza. He is an entrepreneur, author, public speaker, and podcaster. He's renowned for his work in kitchen electrification and is the founder of Forward Dining Solutions, LLC. As the country's foremost expert in commercial electric kitchens, Chef works with governments, manufacturers, brands, designers, and other chefs to create lasting, sustainable kitchens and culinary ecosystems. Again, I thank you all for joining us. And with that, we'll get started. I believe we'll kick off with you, Steph.
Sounds good. Thank you so much. All right, let me see here. All right, so thank you, Tonyehn, for the introduction. And we're going to start just a little bit about the health problems that may arise from having certain types of stoves. And then, of course, after that, Matt and Chef Chris will go into more of the solutions / what we can do to prevent all this, right? So just a very broad overview for air pollution exposure sources. I know we're mostly mainly talking about the indoor air pollution from stoves, but I just wanted to kind of say this is one aspect, right, of air pollution exposure. And obviously from wood or gas stoves, a lot of this poor ventilation and the things that we're going to talk about, but indoor air pollution also encompasses, tobacco smoking, secondhand smoke exposure in the home, asbestos and molds. And of course, there are a bunch of other outdoor sources of air pollution. But really our focus today is more of what can we do from the indoor air pollution, which I think may not always get as much press or recognition. Especially since indoor air pollution is also a major health problem. And the WHO, World Health Organization, right, has mentioned that it's responsible for more than 3 million deaths a year worldwide. And so why is that the case? Indoor air pollution is strongly linked to asthma. Burning natural gas can create a lot of pollutants. One of the main ones is nitrogen dioxide and also particulate matter and carbon monoxide when you're burning natural gas, and that can certainly contribute to air pollution. So according to the Environmental Protection Agency, breathing air with high concentrations of nitrogen dioxide can irritate airways in the human respiratory system, and over short periods can aggravate respiratory diseases, especially those with underlying health issues, including asthma, and also lead to, hospitalizations, visits to emergency rooms. And it's not just the short term we have to worry about. Longer term exposures also can lead to, with the elevated concentrations, longer term exposures can lead to development of asthma and also an increased susceptibility to respiratory infections, upper respiratory or even pneumonias down the line. And so it's important, certainly because with children, right, asthma is a very big disease issue, and the main places that children are home or at school, right, mostly, or outdoors. When we're talking about indoor air pollution, it's important to try to minimize any risk that they have for their health and minimize that risk indoors as well. So in particular, why are gas stoves what we're focusing on, right? So the reason is there are research that looks specifically at the problems with gas cooking stoves. So if you look at children who are living in a home with a gas cooking stove, they had a 42% increased risk of having an asthma diagnosis, and also a 24% increased risk of having a lifetime risk of having asthma. So it's not just in that moment, but if you were having, if you had a gas stove and for a long period of time, and then for some reason down the line, you could have the risk of developing asthma in the future. Additionally, it's not just the gas itself, because we talked about the burning of natural gas, but actually poor ventilation as well. So, not if you have a gas stove, that's fine. If you are able to minimize the risk as much as possible from exposure with better ventilation and things like that, which I think Matt will also go into. But they did see in a study that in homes with gas cooking stoves, children whose parents reported never using exhaust fans or who did not have them available for some reason, had lower lung function and also a higher adjusted odds of asthma, wheeze, and bronchitis, compared to children in homes where they did have gas stoves, but they did use exhaust fans. And so that helps, if you're able to use better ventilation, then that can help a little bit with reducing that risk. And the main thing also to remember is that we like to say, well, pediatricians like to say, no, children are not little adults, right? They actually have more different physiology from adults. And so they have a higher baseline breathing rate. So they breathe faster than we do, and that is normal. And they also, because of that, take in more air per kilogram of body weight. So even if it seems like a short amount of time or short amount of exposure, for a child, they're actually getting more exposure of the pollutants. And so that's why it's really important to consider their health as well, because they just have so much more susceptibility to the pollutants, especially indoors. The other thing too is, kind of depending, where your stove heights and things like that, or again, if you're in a smaller space, they may be closer in proximity to the exposure or to the cooking stove and that kind of thing. So that puts them at higher proximity to the pollutants as well. And then the other thing to remember too is that this actually is an environmental justice issue, because inner city children and low-income households are more at risk as well. That's because smaller homes, they're more susceptible to higher levels of gas stove pollution. And also, because cramped, apartments, in the inner city, you have, frequently have insufficient ventilation. So again, that's just increasing all the risk factors of having more exposure to these pollutants. And they did say, there was one study as well in inner city Baltimore, just kind of looking at, what kind of, when you have these kinds of risks, what happens. And they monitored over a 72-hour period children's bedrooms. So it wasn't even in the kitchen or anything like that. It was actual children's bedrooms. And they noted that over the previous 2 weeks, they did notice symptoms of more increased asthma symptoms. So nighttime symptoms, as well as limited speech because they're having trouble breathing. And that was especially the population that we're looking in, because of inner city Baltimore, was majority African-American, and almost half of the households had an annual income less than $52,000. So certainly, again, that inner city children, low income households just are more at risk for these kinds of things, and certainly is something that we need to keep in mind, especially when we also know that a non-Hispanic Black child is 8 times more likely to die from an asthma attack than a non-Hispanic white child. And so this is definitely something that we can work on and improve. So briefly, I'll go over some kinds of things that, as a healthcare professional, if you work in the healthcare space or with an organization, that you can consider doing. There's a lot of different levels, I like to say, that you can try to be part of the solution. And so obviously from the main thing would be individual patient counseling, right, that you can do to try to do risk reduction. If somebody is able, if they have a gas stove, you can chat about making sure they have adequate ventilation, or if they can switch to an electric stove, that can be something that they would be able to do to help decrease their risk of having these pollutants indoors, right? And of course, not everybody is able to do that, but certain things with risk reduction, right? I'm sure that either Matt or Chef Chris can go into as well. In terms of community partnerships, right? If there's something that you can help do with, working with local partners who are already working on these kinds of things to help with your patient population in your community, to try to see if there's ways to help with the housing, for instance, or people who are working on the environmental justice as well aspects. And then, of course, advocacy as well from either the local or state level, to try to work on regulations or ways that you can help decrease that risk exposure or transition to electrification more easily. And I'm very brief about that because they're very big topics that I know Matt and Chef Chris will probably go into a lot more of those as well. Awesome. Any questions, anything so far? Please let me know. And my contacts at the bottom as well. Thank you.
Thanks, Dr. Lee. I will try and share my screen now. Okay, hopefully that's working and people can see that. Okay, hi everyone. Thanks for joining today, and thanks to Esther and Tonyehn for hosting us. And thanks, Dr. Lee, for that really great and informative presentation. I have 2 young kids of my own, and really appreciate hearing from a pediatrician who's thinking about these issues and knowing that the doctors that are seeing our kids are considering this. My name is Matt Casale, and I'm the Environment Campaigns Director for US PIRG Education Fund. As Tonyehn said, PIRG is an independent, nonpartisan group that works for consumers in the public interest. We, through research, public education, outreach, we serve as counterweights to the influence of powerful special interests that threaten our health, safety, and well-being, which we'll talk a little bit about today. I'm going to talk about the practical and policy solutions to gas stove pollution. People love their gas stoves, but there's a hidden danger seeping out of them. It's the air pollution that Dr. Lee was talking about. Cooking with gas can produce air pollution levels indoors that would exceed EPA health-based outdoor standards. And as Dr. Lee discussed, that means that doing something as simple and innocuous as making a meal can release pollutants into our homes that some studies show lead to the development of asthma, especially in children. may worsen symptoms for those with pre-existing respiratory illnesses. But if you do have a gas stove, it's no cause to panic. There are steps that you can take to protect yourself and your family short of ripping the stove out of your kitchen. These aren't perfect solutions though, so next time you're in the market for a stove, I would consider going with electric or induction, which we'll talk more about. But in the meantime, some things that you should do is make sure that you have proper ventilation in your kitchen. It's best to use a ducted vent hood. That means that your unit actually vents outside rather than just circulating the air inside, which a fan would do, right? And you should use it every time you cook, not just when you burn something. I know people don't like to turn them on because they're loud or they're, but they're important. To the extent possible, you want to use the back burners instead of the front burners, which are more likely to be captured by the vent. You can open windows and doors to allow air to circulate. You could get an air purifier that will help with particulate matter. This one is a favorite recommendation of mine. You can buy a low-cost portable plug-in induction hob, which is, they sell them from basically $50 and up, and they're little plug-in countertop induction burners. So it's basically an extra burner in your kitchen, but it doesn't run on gas, and you can use it in lieu of your gas stove whenever possible. And I will say induction boils water faster and cooks faster too. So those are some of the practical solutions that you want to put into practice if you do have a gas stove in your home. But then ultimately, you want to educate yourself about the potential risks and the issues, and then decide for you and your family when next time you're in the market for a stove, potentially moving away from gas. But we shouldn't have to go to all of these lengths just to make sure that a product that we've purchased legally and installed correctly isn't pumping pollutants into our homes, right? We should have systems in place that protect the public from potential harm from our products. So I'm calling this slide policy solutions, but it's really about the bigger, broader changes we need to protect people from indoor air pollution and move our society off fossil fuels ultimately, like natural gas, and toward renewable energy and electrification. So there are things here that governments should do, local, state, and federal governments, and things that manufacturers should do, retailers should do in order to make sure that people are protected. First is that we should adopt health-based indoor air quality standards and ventilation requirements for gas stoves. We shouldn't allow products to be sold or installed in our homes that will exceed health-based standards and that do not meet strict ventilation requirements. So this can be done in some cases at the local, definitely at the state level. And these are policies that could significantly help with gas stove pollution. Gas stoves should also be sold with warning labels or other educational materials that inform consumers of the potential health risks and the ventilation requirements necessary. So, a lot of people don't turn those vents on every time they cook right now because they don't know the full extent of what the air pollution levels would be if they don't use them. Even better, we should include air quality sensors on stoves that alert people when pollutants are above a certain threshold. This again are some policies that could be enacted at the state level, certainly, also could be regulated by the federal government. In fact, the Consumer Product Safety Commission, the CPSC, is an independent federal agency that's tasked with making sure the products that we purchase and use in our homes are safe. And that would be a great agency to take this up and require new warning labels, possibly these air quality sensors and other consumer education and protection policies. Because in electric and induction stoves run on electricity and not gas and are more energy efficient. We should provide local, state, and federal incentives for kitchen electrification, ideally in the form of direct rebates, which are the most accessible. But we also need to protect, those are helpful for people who own their own homes and are purchasing their own appliances, but we also need to protect people who rent or live in public housing. So we should require electrification in public housing and require that landlords adhere to strict air quality standards, as well as provide incentives for electrification of rental units. And then ultimately, we do need to, for public health, but also for climate reasons, right? We need to phase out the use of gas stoves entirely because we need to phase out the use of fossil fuels in our homes entirely. So we can do that through policies that phase out gas hookups in new construction, a step that many cities have already taken, which the state of New York is currently debating. These are sort of the kinds of policies that are going to do what ultimately we need to do, which is move off gas. Of course, none of this is going to be easy. I don't mean to pick on this Instagram influencer here, but it is made inordinately more difficult by what we're up against, which is a powerful and well-funded industry bent on selling more gas. They're the ones who popularized the term natural gas, which sounds great, right? After all, right? Natural gas sounds so much better than methane gas or fossil gas or fracked gas. The gas industry spends a much higher percentage of its advertising budget on gas stoves than it makes from selling gas for stoves. Why? Because people care about their stoves, right? It's a thing. People don't care how their water heater or their furnace works so much as long as it works. It's an appliance, it's hidden away in the basement. Stoves, on the other hand, are in the kitchen, one of the rooms we use the most. So if the industry convinces people that gas stoves are better, whether better for cooking or whatever, they can keep homes hooked up on gas. It's their way into the home, and they're going to hold on to it as tight as possible. So they're even paying these Instagram influencers, like you see here, to promote hashtag cooking with gas. You see hashtag sponsored, hashtag cooking with gas. They tag the American Gas Association. Indoor air quality standards, warning labels, electrification incentives, these are all things that run up against the industry's marketing strategy and eat into its bottom line. So whether it's good for the public or not, the industry is fighting these things tooth and nail. So we need to stand up for, right, the consumer and the public interest and the health. And that's what we're doing, but that's why it's, it is a difficult fight here. Fortunately, though, we do have options, really good options. I have an electric stove in my house and I love it. It has a quick boil feature. And like I said before, I have two young daughters, they're 2 and 4, and they love their mac and cheese. And I always say, when I'm being heckled by a 2-year-old and a 4-year-old while cooking their mac and cheese, it is really nice to be able to boil water really fast. And while electric cooking has come a long way, you don't have those coils on top anymore. Induction cooking is the future here today. Induction technology, it's cool, it's exciting, it's fast, it's efficient, pollution-free in the home. But I will stop there and leave it to Chef Chris Galarza to tell you more about all of that. Thank you, everyone.
All right, ladies and gentlemen. Thanks, Matt. Thanks, Stephanie. Thanks, everybody, for being here. Let's get this slide deck up, if it will let me. Okay. Didn't have trouble before. There we go. Let's see. There we go. All right. So, ladies and gentlemen, I'm here to talk to you about the future of dining, electric kitchens. My name is Chef Chris Galarza, founder of Forward Dining Solutions, the nation's only firm dedicated exclusively to working on electric kitchens. So let's just jump straight ahead and talk about what it's like to be a chef. Everyone thinks it's very glamorous, it's very fun, but in reality, the way that chefs work in the kitchen is difficult. right? To say the least. It's very, very hot, very, very uncomfortable. We work at breakneck speeds where at any given moment we can cut ourselves, burn ourselves, or even worse. At any step of the way, our body is fighting us because these conditions are very, very hot. In fact, I can tell you stories about times where I've looked at my chef coat, my thermometer in my chef coat, and it would say 135 degrees Fahrenheit. And after a rush, a number of us would be clamoring to go to the bathroom so we could throw up, right? It might be TMI, but it's true. In fact, this has been well documented. If you ever read Kitchen Confidential, Chef Anthony Bourdain talks about this in his book as well. But when you work in an electric kitchen, you are able to create without the stressors of the environment put on you. You are able to create where you can breathe, right? Where you can not be sweating bullets or getting sick over the environment. You can create good food quicker, more efficiently in a healthier space. In fact, ASHRAE, they did a study on just this, and they found that between 68 and 82 degrees Fahrenheit is where we would consider the optimal thermal comfort range. They tested over 100 kitchens for a week between summer and winter conditions in all different climate zones. And they found that the only time a kitchen was comfortable is if we were prepping or cleaning. When it comes to cooking, you can see humidity levels, heat indexes far outside of that box, and it's obviously not good. So what happens when you burn natural gas? Well, you are releasing carbon dioxide, nitrous oxide, sulfur dioxide, formaldehyde, soot, smoke, other particulate matters that are not only dangerous to us as the healthy folk, but also children, elderly, survivors of COVID, who, as we know, have severely diminished lung capacities. But more importantly, we also release carbon monoxide. And we're going to focus a little bit on that one because everyone has carbon monoxide sensors in their home, or at least they should. So carbon monoxide is an odorless, colorless toxin, and typical outdoor concentrations anywhere from 0.03 to 2.5 parts per million, with the maximum federal standards saying that anything beyond 9 parts per million, everyone needs to be shut down until they figure out where the source of the contamination is coming from. But when you cook with natural gas, your space can far exceed 200 parts per million. Now, you may remember this from what I just said, but symptoms of which are nausea, vomiting, headache, lightheadedness, all things that we as chefs experience on a regular basis, and just attribute it to heat exhaustion, complications of which are permanent brain damage, cardiac damage, and even death. So very, very important that we figure out a way to create healthier kitchens. And in doing so, we talk about induction cooking. So it's very important to identify what it's not, which obviously it's not gas, but it's also, when we say electric cooking, people often think of these coils, radiant heat, which is inefficient, or it's more efficient than gas, but it's inefficient in a restaurant because we need to cook fast. And these pieces of equipment unfortunately have to convert the electrical current into heat energy, and then that energy has to be absorbed by the pan, which is very slow. Induction cooking works with the pan itself. As you can see, only the pan is boiling, not the ice. Only the chocolate is melting in the pan, not the chocolate out of the pan. So induction is a safer way of cooking using electromagnetic currents to heat your cooking vessel. And it's an easy way to meeting your sustainability goals, as well as saving yourself money and allowing yourself to have a cleaner space. How it works is, imagine your microwave at home. You are sending the aptly named microwaves into your food, which is exciting the water molecules within the food. As it's bouncing around, it's creating molecular friction, which is then heating the food up from the inside out. We're doing something very similar, where we're using an electrical current that's going to be passed through a tightly wound copper coil, which creates what's called an eddy current, which creates a magnetic field that oscillates the ferromagnetic molecules in the pan, heating the pan up from the inside out. So the air isn't getting hot, just the pan, just the food. So pros and cons of the equipment, because we have to look at things holistically. Cons, we're going to start with the initial cost. Now, with the residential side, it's not really a big deal, because if you go, you can buy a great induction range for $1,100. Same thing for a gas range. Compatible cookware for the home cook. In fact, it's most of your cookware at home is actually induction ready. If you want to test it, grab your magnet off your refrigerator, put it on the bottom of the pan. If it sticks, you're good to go. To jump back quickly on initial costs, for the restaurant chef, that's where it gets a little crazy, because your 6-burner gas range will cost you about $32,000. Your 6-burner induction range about $38,000, which isn't a big deal in the sense of building a kitchen, but there are also tax credits, incentives, all these things that you can do to offset. Where what is a big deal is that oftentimes restaurant chefs they're stuck using copper or aluminum pans, which do not work on induction. So they would have to swap over. But the good news is that, your heirloom, the Dutch oven or cast iron pan works perfectly on induction. You don't have to worry about scratching the surface or anything like that. It's very, very sturdy. Also, another thing that's cost prohibitive for a lot of people is the electrical capacity. How much is going to cost to upgrade panels? Do you have to upgrade panels? Do you have the wiring ready to go? You need to hire somebody to do that. The retrofit hurdle can be costly. Now, the pros, very, very high efficiency. We're talking 80 to 93% versus the 35% for gas. Heats up very, very quickly. Precise temperature adjustments, which as a chef, I love, because I can write my recipes to the gram, but if I say to braise something at medium low, we have medium, we have low, then we have a big gap here. And contrary to popular belief, you can't over and under braise items. There'll be no more idling equipment, no more combustion, which means no more carbon monoxide poisoning, right? Or carbon monoxide being released into your space. There's a dramatic improvement to thermal comfort, which we'll talk about later. And it's also going to extend the life of your pots and pans. No more warping, no more carbon buildup, no more scrubbing the bottom of your pans, no more hot and cold spots. Your pans will last significantly longer. I know that because traditional commercial kitchens have to replace pans every 3 to 5 years. At my all-electric kitchen that I was running before I started doing this was going on 6 years, and it still looked like it was brand new. No warping, no buildup, no nothing. There are a lot of solutions out there. In fact, there is nothing in your gas kitchen that cannot be transitioned to electric. That includes griddles, ranges, fryers, broilers, grills, steamers, tilt skillets, combi ovens, you name it. It's all there. The technology is there. It's been around for a long time. It's even allowing us to refine tradition. So this is an electric tandoori oven and an electric or induction wok. And like I myself am Latino, and my grandmother is a second generation out of the Amazon rainforest. So when it comes time to inherit these recipes, it's going to be a way of me to almost like a spiritual way of communing with her. It's important to me. It's important to a lot of cultures out there. And cooking allows us to do that. So when people think that we're going to be changing the fuel of cooking from gas to electric, they think you're coming after their heritage, when it's not true. And in fact, if you look at that induction wok, each commercial induction wok can save you up to 1 million gallons of water per year. It's a big, big savings. Heavyweight bout now. Gas range versus induction range. Who's going to win? I'm going to give the gas range every opportunity to be successful in this, and we're going to say that this particular gas range is a unicorn. It's 50% efficient. I've never seen one. I've heard of one, but never quite seen and been able to track down the model or anything like that. But let's just say it exists. Let's just say you have it, and at that efficiency, you cook 38.6 pounds of food per hour. It's going to need time and elbow grease to clean, which if you've never done, I'm happy to explain it. You will. After you're done with your shift, right, you're going to take all those burners out. You're going to those grates, put them in a sink with degreaser and hot water, let them sit for a while, and then you're going to pull out those burners. You're going to take a toothpick and you're going to stick them in every single one of those holes, make sure there's nothing obstructing the gas flow. They're going to soak that as well. You're going to scrub down the whole piece of equipment, dry that off, pull the drip tray out, drain that, take the foil off, degrease that, scrub that down, dry that off, put the foil back on, put the drip tray back in, scrub those burners, scrub those grates, dry those off, put those back on, and don't forget to light the pilot light, because if you don't, the guy in the morning is going to be really upset, because it can cause an explosion. All the while, again, time and elbow grease, but also can cause burns, and it can cause fires, both of which I've seen and experienced. Induction, though, we're talking 90% efficient. 70.9 pounds of food per hour, easy to clean, safer to use. In fact, if you were to boil milk, for instance, it wouldn't burn. You would just wipe it off. Hot soapy water, you're in and out of there in just a couple of minutes. In fact, pro tip, if you were to put a towel underneath your pot, say you're doing marinara sauce, and you're worried about splattering and having to clean that up later, put a towel underneath. It's not going to burn. It's going to catch all the splatter, and then you can get done cleaning a lot faster. Now, all these efficiencies, I want to say that those are under lab conditions. I can say unequivocally that in the commercial kitchen, we do not run equipment the way the scientists do. So oftentimes, truly, in a gas range is about 35% efficient. In the field, we're looking mid to low 20s, sometimes lower than that. In fact, your wok is about 19% efficient. Anyway, moving on from that, clear winner, induction. But what about cost? Electricity is going to cost more than gas. Everyone knows that. So let's do a little thought experiment. So assuming we're going to run a 6-burner gas range and a 6-burner induction range for 360 days a year, 15 hours a day, the gas range is going to be $1 per therm or $1 per 100,000 BTUs. And the induction about 17 cents per kilowatt hour, which is above the national average. You're going to see that your gas range is going to cost you $1,123 per year. And the induction is going to cost $1,114 per year. That's not to say, sweet, we saved $9, doesn't really matter. What we're showing is that the cost of operating is the same, even though electricity costs more. Why that is because, again, the efficiencies of these gas appliances are so low that you're spending more to run that piece of equipment. So for every dollar you spend, 65 to 75 cents of that is you're throwing it away, and it's in fact warming up your space, which causes your air conditioning to run more, and it's going to cost you more. But because we're talking about 90% efficiency with induction, you're able to get a lot more energy into the food faster, get the food cooked faster, get the food out faster, and get the equipment off a lot faster. And you're only, for every dollar you spend, you're only wasting 10 cents. So we talked about thermal comfort. What does that look like after we've converted? This is data, real world data from my kitchen, September of 2019 to September 16th of that same year in Gibsonia, Pennsylvania. You can look it up. Anywhere from 85 to 90 degrees Fahrenheit, not a cloud in sight. It was absolutely perfect summer week. It was a week that you would have wanted to take vacation on. In fact, that week, during production, during service, next to my ovens, it never hit 74 degrees Fahrenheit. And we were much cooler than if we were to be outside. And my building does not have air conditioning. So it was much, much cooler in my space. We were able to be comfortable, enjoy the work we were doing, and to boot, have cleaner air. Now you may be thinking, I'm sure, you guys had a great time, but you can't produce quality without gas, period, bar none. And in fact, the best chefs in the world use gas. I'm going to push back on that by saying the Fat Duck, Heston Blumenthal, one of the best restaurants in the world, one of the best chefs in the world, all electric. And that's out of the UK, but maybe something closer to home. Pineapple and Pearl out of DC. Esther, you're there. You should check it out. It's all electric. Per se, Thomas Keller's restaurant in New York, all electric, 3 Michelin star restaurant. Alinea, all electric, 3 Michelin star restaurant. French Laundry, one of the greatest restaurants probably ever, all electric, 3 Michelin star restaurant. In fact, Noma, #1 restaurant in the entire world, is all electric. And the Culinary Olympics at Bocuse d'Or, the preeminent culinary competitions on the planet, where the best of the best go to compete, all electric. In fact, every international culinary competition in the world is all electric. So the idea that we can't produce quality, the idea that it's not as efficient, the idea that restaurant chefs don't want it, with the idea that it's going to cost more to operate, those are all myths. They don't exist. In fact, this is a much, much better way of operating your kitchen, of being able to cook good food and being able to enjoy yourself again. So thank you guys for your time. I appreciate any question that comes our way. Contact info is on this slide, and yeah, fire away.
Thank you, Dr. Lee. Thank you, Matt, and thank you, Chris. We are going to transition into our question and answer. So please, if you have questions, I see 2 questions in the Q&A, and I think I saw a question in the chat from Daniel or David. We're going to pull it out as well, but please add more questions. I'm going to kick it off with a nice and easy, relatively speaking, question for all of you. Then we'll pick one of the questions in the Q&A. How would you encourage an individual who's unsure about participating in policy-related work? If they feel that it might conflict, like I'm a university professor, and we've had conversations where many people are unclear where to draw the line. So maybe Steph, you can, Dr. Lee, you can go first, and then we can have the gentleman Matt and also Chris commenting. For people who appreciate the value of being engaged and are unclear on how to get started, what would be your advice? Dr. Lee, take it away.
Yeah, I've always been very clear with my organization, with Penn State, the overarching organization that I work for, that I'm doing some advocacy work, or certainly like with the committee that I'm co-chair of with the Pennsylvania AAP. And sometimes if there's something that I want to do testimony on or write like an op-ed or something, I'd always just say, I'm speaking on behalf of myself if I feel like it's going to be a conflict. So it's very clear that I'm not representing my organization. And I think that's been working, for me. And that's one way to kind of go around it, to say, even though I work here, what I'm saying is reflective of what I believe. And for the most part, like my employers, both here and then I was previously in South Carolina, like they're fine as long as you had the little legalese there. So I feel like it hasn't been much of a problem for me at all.
Thank you, Dr. Lee. Matt?
Yeah, and I'll say, if you're wondering sort of, well, what do I do and where do I go? Like, how do I even get started? I mean, it's groups like PIRG, Penn PIRG, or Penn Environment. We have state groups across the country that you can get involved with. There are others, both local, state, and national groups that you can always get involved with that have opportunities for volunteering or actions you can take, letters to the editor you can write, all of that kind of good stuff. So there's certainly, if you're thinking, yeah, I want to do some of this, but I don't even know where to start, those resources are out there.
Thank you, Matt. Chris, would you like to share your thoughts?
Yeah, I've never been one to be on like a political activist or anything like that, but I will say that one of the things that I learned growing up was that and maybe Gandhi said this or something, but be the change that you want to see in the world, right? And if you want a cleaner world, you can do that, and you can inspire others to make those changes. I heard something really inspiring lately, that in order to halt the effects of climate change, not reverse it, but just stop it in its tracks, we need to reduce global emissions by 3.5%. The United States, we are 15% of global emissions. So we can affect real change in our cities, in our homes, in our communities, simply by educating each other, adopting these good practices, adopting these technologies that in fact make your life better. And you can be a catalyst for change in your own space.
Thank you, Chris. I'll hand over to Tonyehn.
Actually, well, let me ask one of the questions. I do have one of my own as well. But as far as questions that came in, this one is for Matt. Fascinating insight about the NG industry's marketing budget for gas stoves. What inroads, if any, are there in promoting all-electric cooking with organic, healthy, natural food influencers?
Yeah, it's a good question. I think we're starting to see that a little bit more as this issue has become more present in the sort of national and popular conversation. And so, we've seen stories about gas stove pollution in the New York Times and the Washington Post this year, but also some food magazines sort of for the first time. And then there are certainly like YouTube personalities and chefs who are all in on induction and, really believe in it and are doing that. And some of those are really picking up steam. John Kung is one. He's great to check out. So, I think it's happening, and I'd love to get the HGTV show that only installs induction in the new homes. I watch it with my wife, and every time they put in a gas stove and they put the microwave, or they don't put in a hood, my wife just looks at me and is like, don't get started. So I think there's a real opportunity there for sure. These sort of lifestyle influencers, home design, healthy food, healthy cooking. But it is still a matter of increasing the public education and knowledge about the issue itself, which is happening, but is not quite there yet.
Dr. Lee, there's a question for you as well. What success stories, pilot programs might you know of to get stove and ventilation questions to be asked during doctor's appointments? I know my doctors have not asked questions like that at our family's doctor appointments.
Yes, thank you for that question. It's a great question, but unfortunately, I don't know of any pilot programs or anything going on right now. I think as I mentioned earlier, the indoor air pollution gas stove connection, especially in the healthcare space, I think is still starting to finally gain some traction. And, I had mentioned I am part of basically 3 kind of different organizations and trying to get healthcare professionals more aware of it. I know, especially for pediatricians with asthma, we do talk about triggers or things that might worsen asthma. And so I think sometimes for some pediatricians, they may have that conversation built into their questions, but other than that, you're right, it hasn't been that big of a question that healthcare professionals immediately think of when they're asking about environmental pollutants or things like that. Even just talking about environmental pollutants itself has been slow growing in the clinics. So I think that's certainly an area that we're trying to improve on.
If I could just add the reverse side, because it was a question I was going to ask. This person's asking about physicians not asking questions of their patients. So I have the reverse question as a patient, especially if I'm in a low income EJ community. How can I ask my physician to advocate for me? And do you think that would be appropriate?
Yeah, certainly. I think that always bringing something up, if you feel like that's a concern, is certainly a way to start that conversation and get that conversation going. There's certainly times where, for instance, if there's a patient who, we mentioned some of the other air pollutants like mold, asbestos, right? If somebody is renting and they notice this, there's already an established, I guess, kind of awareness that your physician can write a letter to the landlord and say, hey, this is a health risk. We know that this leads to worsening asthma and allergies. And so, legally, you can take this and say, hey, this is something that's dangerous to my health and you need to fix it. So I certainly don't see why that couldn't be applied as well to say if there's poor ventilation, gas stoves, things like that need to be fixed, that you could bring up to your doctor to say, hey, put a little pressure on landlords or whoever to try to get that fixed.
So there's a question in the general chat. Thank you, Dr. Lee. There's a question in the general chat that is for you. So you're still on the spotlight. Can you provide citations? Sorry, this is about the references for the material that you quoted earlier. Do you have source materials that support your great emissions and exposure discussion? And is this something that you're willing to share?
Yeah, definitely. I think there was another question about whether it's recorded and it'll be sent out. So when they send out the recording, I'll be happy to include my slides with the different references to each fact that I presented.
All right, thank you. I think we have one more question that hasn't been answered, and this is for you, Chef Chris. What initiatives, if any, are there to retrofit culinary schools to be all electric? And do you think that would be a useful strategy in promoting all electric cooking? That's from Sarah Klein-Tobler. Thanks, Sarah, for the question.
Yeah, for sure. Thanks, Sarah. There is, as of right now, people that are working on trying to get those conversations in the door. myself being one of them. But yeah, currently there's very few culinary schools that teach on this equipment, which I think is, to put it bluntly, irresponsible. I think if you're going to take these kids' money to set them up to be chefs in the industry and then not teach them the equipment that they're going to come across, especially if a lot of their goals is to go and work for the Thomas Kellers or Daniel Boulud's or these other giants of the industry, these 3 Michelin-starred restaurants. Because if you walk into a space and no matter what your accolades are, if you don't know how to work the equipment, you're not going to get hired. So I think that if we are setting these students up to becoming future leaders of the industry, they have to understand how to work the equipment. So that's something that I'm pushing for myself. And yeah, I think that's a great way of getting, teaching the future generation about the importance that their cuisine has on the world. It's not just the people that are eating it, it's the people that are working those kitchens. It's the people that are going to be outside of those spaces in which your missions are going to be affecting them. And it's who you inspire, because I don't fully understand it, but chefs have this almost, I don't know what it is, but like we have people's attention. And I think to use that to promote or to continue on with the status quo, when you can make a difference through your cuisine, I think is a missed opportunity. So yeah, I think that if anybody has a connection with the CIA, not that CIA, the Culinary Institute of America, the Johnson and Wales, any culinary schools out there, I think please send it along to me, because I would love to get into those conversations. I'm doing everything I can on my part, because currently I'm the only commercial chef in the country talking about this, especially with such fervor, and working on this. And we're doing everything we can, from working with the federal government on the Energy Star certifications for induction, which don't exist yet, to working with the state of Pennsylvania, the city of Ithaca. We just worked with the city of Berkeley to defend them on the lawsuit that the California Restaurant Association levied against them. And we're actually going to be on a panel this week with their vice mayor. So it's important to get the message out, to educate folks, because what's going to happen is this is going to be the single biggest topic in this country. Once all the things that are distracting us, COVID, Ukraine, once all that hopefully positively gets resolved, we will then turn focus back into this country. And a lot of folks don't realize that in California alone, over 54 cities and jurisdictions have passed gas bans. Title 25 of the state of California just passed, which will effectively force electrification for new construction of residential buildings. The state of New York is working on banning gas. The city of New York has done that. The city of Ithaca has done that. Many states and jurisdictions are already working on this. It's gone coast to coast. In fact, rumor has it that Detroit's also working on this. I can't verify that, but if that's true, then the Motor City going all electric would be symbolically huge. So what I'm afraid of is that if we don't educate people, culinary school students, stay-at-home moms and dads, and everybody in between, this is going to turn into a political fight that is going to be cyclical and never end. So education is going to be key, and it starts with younger generation, and hopefully we can excite the older population as well.
Thank you, Chris. Before I hand over to Tonyehn, I was going to ask, the things you've mentioned, are there some resources that are available as digital copies that we can share with the participants afterwards?
Absolutely. I can share my slides. And if you go on forwarddiningsolutions.com under the resources, you can actually go to the decarbonization guide that we helped write with the William J. Worthen Foundation. And for those of you who don't know, you're missing out. This is a 100% free resource. The William J. Worthen Foundation actually wrote the water reuse practice guide that was inducted into the United Nations Library of Resources, which is huge. That's an 85-page document. We worked on the single biggest, most comprehensive guide on the subject of building decarbonization and kitchen electrification ever written. Our chapter 5 alone is 65 pages to put it in, and there's 7 chapters. So it's go and check it out. 100% free resources. Everything I talk about is in there in much, much more depth with sources and all those things.
Our last question kind of referred to, I think, what you're talking about, because they were asking about states or cities that have good policies around promoting all electric cooking.
Yeah.
So we will make sure that we add a link to your website and the resource guide when we send out the recording, because I'm guessing you can find information there.
But yeah, to jump on that real quick, there are places in California that you can go to a library and rent out an induction hob and just go home and test it out. You don't have to spend the money to test it out when you can just go to your library and borrow it. So there's a lot of folks that are piloting those things. There's programs that are starting to pop up now, but in this country, it's a very new conversation. It's not new in the rest of the world. In fact, as the United States, we are 30 years behind the trend of electrification. Like I said, every international culinary competition in the world is all electric. So the fact that it's gotten there and we're still having the discussion on how we're going to get a piece of metal hot, I think we're behind the times, because culinary cooking is about fundamentals, not about the fire or the electric. So your braise will always be a braise. It doesn't matter if it's on a campfire or on your gas range or on induction. That's not going to change. The technique isn't going to change. And that's something I'm hoping to change, is the perception that this blue flame is going to be what makes or break your cuisine, because it's not true.
I love the idea of being able to get an induction hood or an induction
Hob.
Thank you.
Yeah.
From my local library. I feel like this is something that we have to make happen.
Agreed.
Especially if we can get it to libraries that are in these low income and EJ communities, because one of the questions I had was like, what are your resources if you can't switch out your stove? Is an air filter enough? Which it doesn't sound like it would be. The recirculating hood obviously is not going to solve your problem, but if we could supply libraries with a couple of these induction hubs, then at least we can say, check your local library. So
I agree 100%. I agree 100%. Let's make this happen. And just so you all know, our work, which we're hoping to begin here in a few months with the state of Pennsylvania, is to develop a rebate program that would specifically target those schools in those communities, because we believe, and the data is clear, that environmental factors are the number one chief cause of childhood rates of asthma. So if you could remove combustion sources from the home and school, that's like 80% of where the kids are. And for those of you who don't know, that's a $50 billion a year healthcare cost for American families. And a lot of us can't afford it. So our hope is that this pilot program that we're going to do is going to catch on like wildfire, excuse the pun, and we're going to be able to offer it more to to schools. So once that's done, I'll be happy to share it with you guys, and let's get the word out.
Thank you, Chris. So as we begin to wrap up, we're going to invite each of you to say a few closing remarks. We have 2 minutes left, so maybe in 30 seconds or 45 seconds. Steph, do you want to go first? Dr. Lee, do you want to go first?
Sure, no problem. I think everybody has really gotten great points. And I think my final thing is, kind of we talked about, if you haven't heard about this kind of discussion before, especially with your doctor, bring it up and have that discussion, and, talk to other people, healthcare professionals that of, to kind of say, hey, I heard this, great talk, and what do you think? And kind of just start that conversation. Because I think in terms of the healthcare world, we're just trying to get that awareness out there now. I don't know, just to my horn, but I feel like pediatricians do know a lot about environmental health, but sometimes other specialties, they have a lot of other things to think about, and sometimes don't think about the children's aspect and in terms of all the things that they're exposed to. So it's definitely important to start making sure everybody's part of that conversation.
Thank you, Dr. Lee. Matt, would you like to have a few words?
Sure. Well, I told you that I had young children. Yeah, well, I'll just say, like I said, I think this is an important thing to think about, especially if you're in the market for a new kitchen, new kitchen upgrade or new stove, is to go out there and read all these resources and think about what's best for you and your family, and consider switching to electric or induction. But bigger than that, I think this is just the kind of thing we need to be talking a lot more about in public places, in big spaces, in policy circles, with the manufacturers, with the retailers. The more that this discussion moves forward, where we're actually getting the information out there to people about what the health risks are, what the climate risks are, the more we're going to be able to move these things forward and make it easier for everybody down the line to be protecting their families and the environment. Thank you for this.
Thank you. And last but not least, Chris.
Yeah, so food has always been the great equalizer. It doesn't matter who you are, what political aisle or political camp you belong to, or anything like that. At the end of the day, you have to eat. And people find common ground at the dining room table. So never in the history of at least not in my lifetime, but in the history of the world, has cuisine been so important. Because through food, you can affect change on a global scale, right? I think that the kitchen will be the most important frontier in our fight against climate change. So you have the power to influence others in the positive way. So use that how you see fit, but yeah.
Yeah, thank you. So I realize we're at the top of the hour. On behalf of everyone, this was a co-branded webinar. This was a partnership across 4 different organizations. We thank you so much for joining us this morning. I say a big thank you to Dr. Lee, Matt, and also Chris for taking time out of your busy schedule to share your expertise with us. Thank you, Tonyehn, for co-moderating alongside me. And we also had Lorraine helping out in the chat, and I believe one other person was in the chat. Emily, is it? Thank you for being here. All the participants, Monday morning, you showed up and you're engaged. Thank you so much, everyone. We'll do this again. If there's a question that wasn't answered, just email us and we will get it included in the recording when we post it. Have a wonderful week, everyone.
Take care, everybody. Stay safe.